Okay, good morning. It is April 7th, and this is the Senate Health and Welfare Committee meeting. And this morning, we're going to begin our discussion on budget appropriations. And we've received in health and welfare, of course, significant requests and needs. And we have already passed some bills out. So we'll be looking at some of the money that we've included there and what our priorities are. So today is an opportunity to hear from Sarah Clark and Nolan Langwheel about what is in the budget, what's not, and then we will work together to think through how to make some of our decisions, and thinking in particular around the bills that we've passed out, and then maybe combining some of the appropriations that are there or we would like to see there. So we would be looking at things like opioid prevention, recovery, or we might be thinking about childcare and what is in the budget or in finance that might offer a combination. And then workforce, just as an FYI for everyone, our committee will take time to look at the workforce language that's in the economic development bill, as well as our other thinking on the workforce, and so we'll set time away for that. Okay. Okay, let's go.
Great, good morning, Sarah Clark. I'm the Deputy Fiscal Officer at the Joint Fiscal Office. You should all have a sheet in front of you that is a Word document that attempts to highlight all of the human services related areas in the House passed FY23 budget. It includes not only things that the House may have changed from the governor recommends, but I've also included some information on some of the key policy initiatives that were included in the GovRec that are also in the House budget, just so that you have that awareness. Big picture, it was an $8 billion all funds budget. Of that, $2 billion roughly is general fund. At the top of the sheet in front of you, I'm focusing on the changes that were made to the base budget. Number one there you see is related to the provider increase. If you recall, the governor included a 3% rate increase. The House budget increases that to 7%. This is a rate increase that will go not only to DAs and SSAs, but also ACCS and HCBS providers. So it is a wide spectrum of providers that will be receiving that rate increase. In total, it's about $37 million gross. And again, this is a Medicaid dollar.
There's a state match for that.
Correct. Correct. The next item, number two, there's an increase of $120,000 of general fund to the AHS Secretary's office to go to Vermont Legal Aid for an attorney position in the Healthcare Advocate Office. I'm going to just keep rolling through. If you have questions, please just let me know. Okay. Okay, number three on this section is a variety of funds that are going to the Vermont Department of Health, to include $295,000 of general fund for AIDS client-based support. The bill further breaks down that $295,000 with $135,000 to Vermont Cares, $105,000 to the AIDS Project of Southern Vermont, and $55,000 to HIV HCV Resource Center.
So as we're going through, and I'm just going to ask Nolan. We're going through, we also have a list here of the asks. Mm-hmm. And can you keep track for us?
Yes.
Where the increases are? That would be helpful. Thank you. Okay, we don't have to do it one at a time. Okay.
Great. The next area of increase to the health department is $560,000 of general fund for HIV prevention and syringe exchange. This includes funding going directly to the Howard Center, $200,000 of that $560,000. Item 3C, is a $400,000 general fund appropriation for Jenna's House, which is I think a substance use treatment community in Johnson. This is actually $100,000 less than what was in the governor's recommend.
Which one is that?
That is 3C, Jenna's House.
Okay.
Item 3D is $612,500,000 for the Substance Misuse Prevention Coalition. The governor recommend had $3.5 million for this coalition. The House reduced that amount and used the funds in different ways, but they did keep $612,500,000.
So that, where is that? That's general fund dollars.
Correct,
Okay.
correct.
This is the kind of thing I'm, thinking about, but maybe other things that link in and that can fit. Be a 1 year and then fit with whatever's coming over with, I don't, I'll have to sort it out.
With the settlement.
Yeah.
The next item, 3E, the House budget has $880,000 of general fund for substance use disorder residential treatment rate increases. These are organizations like Valley Vista that were not included in the provider rate increase that we talked about above, and so the House set aside some specific funds for that. And the last item in number 3F, there is $1,279,000 of general funds for sobering beds and recovery housing. That is a component that was included in the governor recommend. The House funds it at that level.
Okay.
Number,
Just a quick question on that, and that's just for Nolan, I think. And how does this link up with the request? Just follow up. You don't have to
I'm
answer now.
circling the ones that are in the asks that I've seen.
Okay.
Now, when I go through my list, I can mention.
great. Number 4, we are moving to the Department for Children and Families. This is $400,000 of general fund to go to the Office of Economic Opportunity for the community action agencies for the Volunteer Income Tax Assistance Program. Number 5, it restores $130,000 of general fund in the Department for Children and Families to postpone the elimination of the Reach Up medical review process. This is linked to H464, which I think you're discussing later this morning.
Right.
Item number 6 adds $100,000 of general fund to the Department for Disabilities Aging, Independent Living for a grant to the Vermont Association for the Blind, Visually Impaired for technology training for disabled Vermonters. Number 7 is in the Department for Children and Families, Child Development Division. And this includes roughly $900,000 of all funds to provide for an increase to children's integrated services. Number 8, I have it noted because the House budget removed what was a $6.9 million general fund initiative in the governor recommend in the Child Development Division to expand provider network for school-age children. So that was removed in the House budget. It is not included. And I think to your earlier points, Chair Lyons, about looking at the entire child care package, and the House, as you know, they have a $48 million child tax credit proposal that has passed the House. And so part of their thinking when they looked at some of the children-related initiatives and the governor recommend, they kind of weighted across some of the actions the House took. So.
Yeah, so that's what I was thinking about. And so the decision around the balance between appropriations and revenue isn't going to be made in here, but it's certainly something we can identify in our letter. So, we're going to finance credit. Yeah,
Is probably gonna be altered just
sure.
to reach the revenue.
Okay.
The revenue's necessary.
So that,
And then number 9 lists a whole host of things that were included in the governor recommend that the House concurred with. But I think I was in here for budget adjustment. I know you had some similar questions. So I wanted to list these here so you understood that they are funded in the House budget. And so that includes things like the DEVA annual rate adjustments that are rate adjustments that affect a multiple of provider types, but most notably primary care providers. You know, that's been a point of interest in this committee. It also includes a per diem for emergency departments that is meant to address access to care issue. Both the per diem, the emergency department, and the DIVA annual rate adjustments are items that were included in the 22 budget adjustment, and this is building it out into the 23 base budget. And then item 9C within the Department of Vermont Health Access is expanding the postpartum coverage to 12 months. There was language in budget adjustment that called for that, and this is now there's funding in the base budget to allow for that. There are two initiatives in the Department of Mental Health that was in the governor budget and the House concurs with. One is the expansion of the mobile crisis response program. If you recall, last year's budget included funding for a pilot in Rutland. This proposal will allow that program to expand to 5 communities. I don't think they know yet which will be the 5 communities that it'll be expanded to. It also is leveraging 85% federal participation, which is the direction that was included in last year's big bill, that the agency should look to the future and leveraging federal dollars as appropriate. Also within the Department of Mental Health, there are suicide prevention initiatives. These include a coordinator position at DMH, 0 suicide initiatives, and funding for the 988 line.
So this is consistent with the bill that we've been looking at S69. And then the question will be around the language that's in the big bill.
Yeah.
Probably.
I had the letter that you forwarded in my list.
From which?
You forwarded me a letter this morning from Suicide Prevention.
Yes, I did.
I added that to the list,
Oh, okay.
so you can talk about it in the context of that too.
Okay, that's good. Yeah, because the language that they sent us this morning is significantly different from what we looked at yesterday with Katie, so it might be an improvement, actually. Okay.
Okay, I am on 9F. We are in the Department for Children and Families. The governor had 3 what I'll call initiatives that the House concurred with. One is funding to support the implementation of the Families First Prevention Services Act. I'm sure you are aware, but this is federal child welfare legislation that states must come into compliance with in order to be able to continue to leverage 4E federal funds. And so these are funds and steps that DCF will take to come into compliance with Family First Prevention Services Act. This budget also includes a foster care rate increase to support foster care families. And it includes funds for a child care financial assistance program, CCFAP rate adjustment. It brings the rate from the 50th percentile to the 75th percentile and aligns with the federal standard. It also allows providers to have increased number of close days. So those are the base highlights in the human services arena.
There's nothing in the base on parent-child centers.
There is not beyond what was existing in the base, so there's no
So they
changes
haven't
to that.
increased it. Okay.
Correct.
That was the Senate bill, so.
Yeah.
Okay, the next section highlights some one-time general fund investments. These are in the B1100 section of the bill. So the first one, in addition to the base increase that Vermont Legal Aid received up above that we discussed, there's also $270,000 of one-time general fund to support the Office of the Healthcare Advocate, as well as $150,000 to go to the Poverty Law Project at Vermont Legal Aid. Those are one-time general fund investments.
That's, so the 150, is that for the new attorney that they were asking?
No.
No, it's not?
They're
Okay.
asking for the 120,000, a separate ask outside.
Okay.
And there is $120,000 for an attorney up above in the base budget in the Secretary's office for an attorney at Vermont Legal Aid.
Okay, thank you.
Okay, number 2, on the one-time investments to the Department of Health, there's $540,000 of general fund for recovery centers and $500,000 one-time general funds for tobacco prevention activities. Number three, I know there's a Senate bill, though the number is escaping me right now. This is related to the Green Mountain Care Board and a $4 million general fund appropriation one time for delivery system reform and value-based payment work. Of that $4 million, it includes $2 million of general fund for consultants with expertise in community engagement and system design to provide a patient-focused, inclusive redesign of Vermont's healthcare system. Flipping to the back of the sheet, in that 4 million, there's also 1.4 million of general fund to go to the Green Mountain Care Board to develop a methodology and propose rules for establishing aligned fixed payments to hospitals. And then the last chunk, $600,000 of general fund to support the board and the Agency of Human Services in developing and negotiating with the Centers for Medicare and Medicaid Innovation, CMMI, to make sure that Medicare is included as a payer in Vermont's payment and delivery system reform initiatives.
Okay, so this is not, we
This,
had 5 million in our bill.
yes, they did it different in the House. They didn't do a bill. You passed the bill 285, which breaks up the money differently.
Okay. So, and we don't know what they're doing with the language in the bill yet.
Yeah, the House Healthcare Committee has not taken the bill.
Right. I think I'm going in there on Friday after that.
They
Okay.
only got it, I think, the other day.
Yeah, it is good. Okay. All right, good.
This recommendation that's included in the big bill is from the House Healthcare Committee based on their feedback to House Appropriations,
Got it.
just for your awareness.
Okay.
Okay, then I'm on the back page of the sheet, moving into a different flavor of one-time investments. This is leveraging American Rescue Plan Act State Fiscal Recovery Fund dollars. So ARPA SFR, as I refer to them. This is in the G600 section of the bill. And there is a $45 million ARPA State Fiscal Recovery Fund appropriation to Department for Children and Families OEO for home weatherization assistance. This is a continuation of a program, a longstanding program, but there were significant investments of SFR last year, and this is another tranche, $45 million for that program.
Do we know if all the money that was appropriated last year has been expended or at least identified for expenditure?
It's been obligated through the appropriation. We received a status report of ARPA State Fiscal Recovery Fund spending from the administration in mid-December. I don't think there were a lot of dollars out the door yet in this specific program, or many programs, to be clear, because I think it's taking the agencies and departments time to kind of stand up these new programs.
Okay.
And there's a review process to make sure that the programs align with eligibility standards of the American Rescue Plan Act. I have requested and can provide the committee an update, an updated accounting of how the spending, where we are kind of year to date on the ARPA State Fiscal Recovery Fund. So I can circle back when I have a better
That would
sense.
be great.
Well, is there a deadline for spending that money? Is it 2024?
Yes. So the funds have to be obligated by December 31st, 2024. But states have until December 31st, 2026 to actually spend the funds. So, and I think you'll find the House version of the budget, the broader State Fiscal Recovery Fund, we have both the governor recommend and the House budget has kind of fully obligated all of the State Fiscal Recovery Fund dollars. So I expect when we leave here in May, that all of those dollars will be obligated. There is another human services related State Fiscal Recovery Fund investment, and that's to the Department for Children and Families Economic
I
Services.
just want to, we're on number 2.
Yes,
Yeah, no, let's go to number 2 and then I want to just take a step back.
Sure. So number 2 is $1.5 million to the Vermont Food Bank to support the Vermonters Feeding Vermonters program. If you recall, the budget adjustment had a $6 million State Fiscal Recovery Fund appropriation to the Vermont Food Bank. This is another $1.5 million, but I know when Nolan reviews his request list, I think they asked for $6 million in 23 as well.
Okay, so this is food bank, and then is there anything in the budget on the school programs, or is it being decided now?
Do you mean specifically school meals?
Yes,
That is, I think, being actively decided and discussed now.
okay, but so it's not represented here at all?
It is not.
Okay, all
Yeah.
right. So I just want to go back because I saw Tina Zuck come in to the committee room, and I'm going to ask you or Nolan, the money that's being appropriated here, the 612,000 general fund that's in for tobacco prevention programs, is that the same as the, you know where it is better than I do on this? Is that, or was there additional?
Let me just look at my thing. Let's see, the House passed. Okay, the difference is that they're asking for it to be base. This is 612,500 one time.
Okay, this is the one time, okay,
They're asking for it to be base, and they said the original ask was $1 million.
okay.
Yeah.
Yeah, that's good. Thank you for a reminder. And then we do know that the Attorney General's office has received some settlement funds. So how does this correspond with the settlement funds that have come in?
Yeah, so let me, that question came to my attention this morning, and so what I'll say, thank you for the information. What we're gonna do is reach out to the Attorney General's office to confirm and understand the status of the settlement dollars and what has flowed into the state.
Okay,
And then I can get back to Tina and the committee.
yes, great. Okay, that'll be helpful. Every little bit helps.
Nice to meet you.
Okay, good. All right,
Okay, so the next section is other bills, and I think, I only highlighted 2 here because there were a lot, there are significant appropriations and also kind of relates to other parts of the big bill. I think the first one here I have is H728, which I can defer to Nolan because I know he has a list he's gonna walk you through later.
Mhm.
I don't think on your list, Nolan, was H703, which is workforce development. And there's many pieces to the workforce development bill. The ones that are on this list are focused in the kind of human services realm. If it's helpful for the committee, I can walk you through the human services focused components of the H703. I know you said you're gonna have a longer conversation about workforce.
well, let's go through it.
Okay.
Yeah, no, this is our first opportunity to look
Yeah.
at it. Yeah.
Great, okay, so there is an H703, there's a $500,000 of ARPA State Fiscal Recovery Fund to go to the Agency of Human Services Secretary's Office for grants to refugee or new American focused programs to support employment. In 2B, there is $720,000 of general fund that's going to the Department of Corrections, which I don't think this is necessarily your jurisdiction, but I thought for your awareness.
Well, the only way it would be is if it's covering MAT programs in some way.
It's not, it's
or
vocational
reentry.
enhancement. It is,
Okay.
there is a pilot at Chittenden Correctional Facility for a reentry
Yeah, for
program,
the
so there
women.
are funds in H703 for that.
Okay,
So that'll be of interest to you.
okay, yeah, we probably will gonna look at that when we get to that bill.
Yeah.
Ultimately, okay.
Okay, item 2C are all kind of nursing program related. Altogether, it's about $11 million across the variety of programs. I'll go to 2CI, which is a $3 million ARPA State Fiscal Recovery Fund appropriation to the Vermont Department of Health for emergency grants to support nurse educators. So these are funds that will flow to nursing schools that'll be spent over 3 years, so roughly $1 million a year, 23, 24, and 25.
So this supports nurse educators.
That's correct.
Well, we'll have to look at the language. I'm not, we don't hold it now.
Yeah, and we have a really good fiscal note on this bill that gives some like dollars and narrative associated. I think the committee will find helpful.
Oh, that'd be great. Did you do that? No, you didn't do that. Who did that?
Pat Titterton in our office did that.
Okay.
He's a new analyst, but he's
New
really
new guy.
laser focused on this area. So it's been very helpful.
All right, we should get that. We can
I
get
can
that.
forward it to Aaron.
Okay, that'd be great.
Or not.
Okay, I think we're now over capacity. One person is gonna have to sacrifice him or herself.
Rock, paper, scissors.
Rock, paper, scissors.
I'm gonna run out.
Huh?
I've got to run out.
Okay,
Okay, so
okay,
the next nursing program is $2.4 million of general fund to the Agency of Human Services for a nurse preceptor incentive grants program. These are funds that will flow, I believe, to hospitals because it's for hospital employed nurses to essentially create the capacity for them to have the time to serve in that preceptor fashion, working with nursing students.
oh, so this is the clinical,
Yes,
placement stuff, okay.
yeah.
Okay.
That's correct. Item 2C3 is $3 million of ARPA State Fiscal Recovery Funds to VSAC for Healthcare Employer Nursing Pipeline and Apprenticeship Program. So all of this is designed at increasing the flow, the amount of nurses in Vermont.
So who is overseeing, you know, I mean, if you don't know, we'll wait until we look at the bill, but who's overseeing the grants in the first two?
The Department of Health.
Okay, so those are the.
And
yeah,
Department of
yeah.
Health or the
There-
Secretary's
or
Office, so it's
AHS,
kind of a variety of places.
Okay, well, there's an opportunity to look at something, okay.
Okay, the next item, 2C4, is $100,000 of general fund to VDH for the Nursing Forgivable Loan Incentive Program. This is actually additional funds for a program that was created a few years ago. The bill actually renames the program at the Department of Health to the Nursing Forgivable Loan Incentive Program. But there is roughly $1 million of an existing program that started in Act 155 of the 2020 session and then in Act 74 of 2021 appropriations continued. And so this is just another $100,000 for that existing nurse program.
Act 74, where does that originate? That was from is
Act
that?
74 was last year's big bill.
Pardon me?
Act 74 was last year's
Oh,
budget.
yeah, thank you.
Yep.
And then there's another Act 74 that was.
I know, I should be careful about that.
Yeah, okay.
Okay, the next item, 2C B, is $2 million of general fund to VDH for VSAC for the Nursing and Physician Assistant Loan Repayment Program.
So this is interesting because the federal government is trying to understand right now whether by executive order they can eliminate student loans. And the deadline for the decision-making, or when the current situation ends, I think is in August. It'll be fascinating discussion. Well, there may have to be some limiting language or something.
There's also something, if I recall, concern, I feel like I heard somewhere that AHEC felt that this was their program.
Yes, well, this is exactly why we need to kind of bring it all in here, and then I know also appropriations is interested in this conversation, in particular with AHEC. So we're going to have to, we'll have to fold this together somehow.
Yeah, there needs to be
Thank you
reconciliation.
for that reminder, you're right.
And the last item in this area is $500,000 to VDH for Nurse Educator Scholarship and Loan Repayment Program.
And that might be the one that AHEC is more, and also the physician assistant.
Yeah.
Yeah,
Can't remember.
So there's, yeah, so I think you'll find the fiscal note very helpful, but this just gives you a sense of what's in H703 for nursing related programs.
So, and it's my understanding, and talking with the chair of House Healthcare, that committee worked hours on the workforce piece, the healthcare workforce.
Yeah, I think there was a whole group of House members that collaborated together on H703 to include individuals from House Healthcare. So the next item, kind of getting out of the nursing realm, 2D, there is $170,000 of general fund going to the Office of Healthcare Reform at the Agency of Human Services to fund a limited service healthcare workforce coordinator position.
That general fund dollars?
Yep, that's general fund, and that's to cover 1 year of salary and associated operating costs. I think the intent is it would be a 3-year position. I think because of the multiple efforts that are in H703. So then the next item, there's $1 million of state fiscal recovery funds going to the Secretary's office, to the Office of Healthcare Reform again, for Healthcare Workforce Data Center. That includes funding for 1 position. And it's basically the intent is to enhance the public health data system.
Okay, I would have a question.
And then the last item is 2F, $1,290,000 general fund to go to Dale for a pilot employment program to have basically employment counselors embedded in the 12 recovery centers. And so this proposal funds 15 FTEs, so essentially 1 in each recovery center, and then as well as some capacity in Dale. The governor did have a smaller, I think it was under $300,000. It had a smaller initiative included for similar purpose, and the H703 expanded to all the recovery centers.
Okay, and there's nothing in here. There's nothing in here that distinguishes between recovery for folks re-entering from corrections. There's not any specific language.
There's not any specific language in this section of H703 for corrections. So there's the funds that we talked about earlier for a pilot at the Chittenden Correctional Regional.
For the women.
Correct.
So,
yeah.
Okay. Thank you. Any, okay, so
So those are the human services related budget highlights.
So one of the things I think we're gonna have to do is to have maybe Jen or somebody come in and go through the budget language with us. Because there's some policy language probably embedded with all of this.
Some of it, not so much. The
There
one
isn't
time,
so much?
the one time it's just like 1.2 shall
Oh,
be,
good.
then there's other pieces that it's a little more complicated.
Yeah, I haven't looked at it yet, so I'll have to do that.
I would say that's the one time stuff. Any other stuff?
Happy to coordinate with Jen. Nolan and I actually talked about whether we should walk through language today, but we thought given the timing, maybe not. Just
No, this
focus on
is
the
fine.
numbers.
This is fine.
but-
We should do that.
Yeah.
Yeah, we'll do that. And
Yeah.
if it's not a whole lot,
Yeah,
then we won't take a lot.
I can send a document to Erin that will just pull out the human services related language so that for ease of your review.
Good, we can post that and everyone can read it.
Did you
Okay.
send Patrick's? Oh, you don't have
That's
it.
in
I can't hear you.
It's uploaded.
Is it uploaded? Okay, thanks.
Okay, questions committee for Sarah.
I think I'm gonna hang out until 10 and just listen to Nolan too, so
Good.
if there are questions that come up for the 2 of us.
Perfect, thank you. This is a great summary. I really appreciate it.
You have to see half for you.
This one has a cushion. That's a big difference.
All right,
Um,
so we have the new piece of paper in front of us.
New piece of paper in front of you. For the record, all 9 homes at fiscal office. The first page, I won't spend a lot of time on. It's just a highlight of the bills that you have passed, the top part, so I won't go through because you know what you've done. That's the bottom half of the front page, the orange shows you the bills for which, at least the ones that I've done fiscal notes for that have originated in this committee. And these are the House bills that you have before you. One of them you've already passed out, it's 355, to give you a sense of where they are. And also in this sheet, if you go online, I've added links to all the fiscal notes.
Thank you.
So if you're on the sheet, you can get there.
That must be new, because I didn't see it this morning.
Yeah, this one.
That was on my other one from yesterday,
Okay,
but I didn't get posted. So if anyone
fine,
watching
thank you, that's great.
can go and read my eloquent notes. Okay. So I won't spend too much time there. I will just sort of highlight it really quick though. Sarah talked about a 464. You have the 130,000 that's postponing the savings. You'll be talking about that again at, and it's in the budget. I should describe it. It's also 464. We'll get into a little. I'm just flagging it for you as like mental pin. It's going to be probably part of the discussion when you talk about the bill a little bit.
Yes, and and this links in with tax credit discussion as well, of course. Reach out program. Yeah, because look at, they're increasing the money to reach out folks, and then there's also a tax credit that might help them, so trying to sort out.
So with the
benefits.
child
Yeah,
tax credit. Okay, I
so
don't.
not above our pay grade.
Yeah. And if you go to the next page, this is the beginning of, these are the, Senator Lyon and Senator Hardy sent me all the letters that they've received, money requests from, so this is my attempt to chronicle them. These obviously aren't all the requests that are out there. These are all the requests for which you've received requests and have passed them along to me. And so I'll just kind of run through them really quickly, and I'll flag where Sarah may have flagged it already. First one, and they're not in any particular order, they were in the order for which I received them and nothing else. I tried to also kind of highlight where it was base versus one-time ask. Many of the requests were not specific, and so I might have made an assumption.
Okay.
And that's on the requesters to correct. So the first one is the 6 million for the food bank. As Sarah already talked about, there's 1.5 million. And it's on the second page of her documents under one-time investments, ARPA, and it's 1.5. I don't know if this is, if they're asking for an additional money on top of the 1.5 or if these two different things. I can't answer that.
How much have we traditionally funded them?
What was your question? How much?
I part of the muttering the other day was that we didn't used to fund them at all.
Yes, I know, so.
And they got a lot of money last year, but now the request is to keep up that same amount of money.
Yeah, one of the problems we face is the federal dollars have really held things up,
Yeah.
and now there's an expectation that we can fill the gap with state dollars. And so the question is, that's why I kind of look at what are the things we can combine to fill gaps without doing work in your committee to raise revenue.
Well, I tried to put in the description,
I'm already raising 50.
I tried to put in the description, like what they had said, so food banks, they talked about how there's an increased need, especially after the pandemic and record inflation. So I tried to put that in the description, so you understand why they're asking.
Yeah, thank you. This is a lot
Without
of work. I just want to say for you, Nolan, you've done an exceptional amount of work on this, because Senator Hardy and I have been sending you things like 10 times a day. And
Yeah.
there it
Sometimes you send me the same ones, but
is. I know.
it's good though, it's good.
Okay.
This is actually, honestly, to be honest with you, I don't know why we haven't been doing this in previous years. It's a lot easier to put it all in one place, so
Well,
mental flag, let's do it again next year. It's probably a lot easier to have it all in one place.
yes, it makes a lot of sense to me, and I completely agree.
Next, we have for substance, and also, if it wasn't like the food bank or the healthcare advocate, if we're just saying we need more money for us, and the other places might be like for this, or for that, I tried to put little parentheses in the description of who was asking. Like
Yeah.
food bank was obviously asking,
Yeah.
But for some of the other ones, like this next one, it's not clear who's asking, right? So for like this one, I put a little thing, so this request is from the collaborative. And they're asking for 3.5 million. The governor's recommended budget included 3.5 million for Substance Misuse Prevention Coalition. House passed budget reduced this to $612,500 for a Substance Misuse Prevention Council. So there's some concern about the language of coalition versus council. If that's something you can reconcile, then I just flagged it here.
Yeah, that's one of my concerns. That's why, putting together the prevention opioid substance use disorder, trying to sort out where it goes and how it gets distributed. one place.
Vermont's free and referral clinics, they're asking for a 10% increase in their base grant. Their base grant is $1,028,000. So the health departments, they're asking for $102,800. With that shared across 9 clinics, and they say they've been level funded for 4 consecutive years. The healthcare
I'm
app,
trying to remember, did they receive? I thought they received some funds. Anyway, we don't,
I
that's not a
can't talk to
question for
what-
now. That's not a
you know,
question.
to go to Senator Cummings' previous question, I don't know, Pilates, I don't know what their base budget has been in the past or whatever, so I don't know. If you start digging deeper, we can find out more, but.
Some of that work, some of the digger deep has to happen down the hall.
So Healthcare Advocate, I put their two together. They're asking for $270,000. The difference is that they're asking for base, the House appropriated one time. There's also an ask of $150,000 for Vermont Legal Aid, which is outside the healthcare program, but that was also one time. And then they're also asking for the $120,000 to hire an additional attorney. The House budget included this, and I believe it's included in base revenue. Yeah, so that's already included in the base. There's a request from the Snelling Center for the Early Childhood Leadership Institute, ECLI. They're asking for $140,000 one time. This is training, support, networking for rising leaders in early care, and I didn't write this very well.
That's okay.
The first 5 years were funded through federal, state, and local, and then it ended abruptly with COVID and the passing of the coordinator. So they're looking for $140,000 one time to help jumpstart this program. AHEC, they're currently funded at $667,000 annually. The request is for the funding to be restored to the 2009 level of 1.46 million. So that's the 793 is the difference to get from 667 to 1.4 would be 790,000. And you can see this from the Medical Society and other physician organizations.
Yeah, this is where we're gonna have to key in on 703 a little bit.
There's a request from, the next two are from Let's Grow Kids. One is for an early childhood educator outreach and recruitment initiative. That's for $125,000 one time. And then there's another $100,000 for a free apprenticeship program. And they weren't clear whether it was base or one time, so I followed up with them and they said either or.
Take my copy.
Yeah.
Reference.
Okay.
I'm probably gonna stop reading descriptions because we are running out of time, so I don't want anyone to think that I've read the descriptions because I prefer it if I'm just running below. So there's a request for, there's also Let's Grow Kids and the American Heart Association for $4.9 million for CCFAP increase.
That is already in the budget, I think. Yeah, but I just checked their memo. This was just an ask for us to support what's already in there.
Right,
Yeah,
yeah.
so you can take that one off the list.
I didn't
Well, no, don't
always,
take it off, don't take it off.
No, it's already in the budget, so
Yeah,
this is consistent with the things that are not in the budget, so I don't think it belongs on this list.
yeah, I didn't always have a chance to corroborate. When I knew it was in the budget or I had to do some research, I'd flag it in here. But and Senator Hardy's point, I didn't always have an opportunity to follow up whether it was already in the budget or what the bases were or whatever.
Yeah, I mean, their memo says, please recommend concurrence with the House's inclusion of 4.9 million in these additional funds for CC.
So the reason I would say don't take it off is our next step will be to prioritize. And so there may be things in the budget that we, including this one, that in our memo, maybe at the end of the memo or whatever, we can say, please don't take this out.
But I think this is already on Sarah's list, or it should be on Sarah's
Yes,
list.
it is.
Because so this is a list of things that are not in the budget that are additional requests. So it's just to make sure we keep our
Right,
list clean.
Okay, yeah, good, okay, I get it, I understand what you're saying.
There's a request from Let's Grow Kids for child care capacity support programs. This is a statutory request, so I won't put too much more detail on it. We have Vermont tobacco control. Again, we talked about this briefly. The House passed included 612,500 in one time. They're asking this to be base funding. The original ask was 1 million. This is the American Heart Association.
So this is also in the budget. And then the question is about how many more settlement dollars are coming in
Well,
to
there,
the AG, and whether the request for additional funding is viable.
well, there's two pieces. There's that, and there's also, this is one time they want to be based.
Yes.
Which is a bigger,
Yeah.
difference. The next one is the postpartum coverage. This is from American Heart Association. I wrote here, VA required AHS to amend the state plan to include this. The estimated annualized cost for this is actually 2.16 million. 951,000 is the state share. So I don't,
This is in the budget. It was in the.
Yeah, that's what
I thought
so Yeah.
as well.
I suppose, I couldn't recall, again, this was on the fly.
Yeah.
Okay, next one's Vermont Donor Milk Center. They received 25,000 in 2022. They expect the funds to be depleted and they're asking for 50,000 in one time.
And this, the 2022 dollars were federal dollars?
I don't know.
I don't either.
Oh.
But
I don't remember if they were that or if they were they might have been
I
general
don't
fund.
either. I know about diapers. I don't know about this. Ruth, do you remember? I think this was one of the things you had talked about.
Which is
The
this?
Vermont Donor Milk Center. I remember.
Oh, they got 25,000 last year.
Was it, wait, you know if it was federal dollars or?
It was ARPA, I believe.
Yeah, okay.
But I'm not positive.
Okay, well, we
I'm
can
pretty
check.
sure it was ARPA though.
I'm pretty sure
But
it
it
was.
was 25.
Yeah. Okay,
The next one's a big one. My number, actually, I need to confirm, and I realized as I was looking it over before, it's a little confusing. So the governor's recommended, it had a $3 million increase, sorry, 3% increase for home and community based. The House increased it another 4%, so now it's 7%. So that brings it up to $37 million increase. This increase is to take it up to 10 for another 3%. And so that's where the 7 million number is an estimate of how much more money we would need to get to 10%, not how much the 10% costs. So I should have been clear when I realized that the 10% would be in the 40 millions. This is to get above the House recommendation. So
are we talking that to get above it is the 7 million or the 15 million?
it's 7 million general fund, it's
Yeah,
15
okay.
million,
15 million.
well,
total.
16 million gross. But
Yeah.
that's just for the 3% above the House pass.
Okay,
So I'll need to clean up that language to make it clear that it's not $7 million to increase it by 10%. It's 7 million to increase it by 3 more
Yeah.
above
got it,
the House, which went 4 above the governor.
we got it. Yeah.
But I need to work with Sarah to make
So
sure
it's a
that my
lot of
number,
money if you put it all together.
yeah, I didn't have a chance to run it by Sarah and Stephanie to see if my math was good.
I'm sure it's.
I think it's great.
Yeah.
But,
yes,
uh,
it
Yeah,
is.
your math is good. That's the general fund you need to go from 7 to 10.
Yes.
And this is for the area agencies on aging,
No,
just specifically?
no, they requested it, but this is for, I think, DAs, right?
They are one of the providers that
DAs meant.
get rid of that rate increase. This is for, this 7 million would be for all the DAs and SSAs or for just it's for a whole host of provider types to include DAs, SSAs, area agencies on aging, home health. Okay, yeah. But the 7 million is inclusive of all of them. Correct. Okay.
Which is up to 7%. That would be to
The
send.
3% would get it to 10.
It's 3%.
So the governor did 3, the House added 4 to make it 7.
Right,
This is an additional 3 to get it to 10.
These are the three costs.
Programs that we have chronically
chronically
underfunded.
underfunded. So this is one that goes, I mean, for me,
The gross.
this should be on the first page at the top of the page, but.
It's already
Okay,
Um,
just put a little X marks the spot next to that one. That was, I think, for us, we really need to.
Okay, I'll put a big X there.
Right, check.
Yeah, you only cross it out, okay, you want a big check mark. Okay.
Check.
The next one was another request from and so these two from the areas of aging, they didn't give me how much it would cost. They just said, we want this. So with the 10%, I was able to do the math and so I could put the number there. They didn't know how much they were asking for. They were asking for a policy change. The next one, like, I don't know what it would cost.
Oh,
They want a Medicaid rate for adult day to go up to $25 an hour. I didn't have time to figure that out. So you could argue that my ultimate number on the bottom is not inclusive of whatever this would cost. I didn't have time or the ability to, and I'm not going to unless the committee says it's a priority, then I will find out what the math is.
so my question here is, they're asking for $25 an hour, and above, we're talking about a 10% increase. Now, if we combine these two requests and then we calculated what 10% increase for adult days would be, would they fall under the same payment process?
I have no idea. I don't know. I think that,
Are they Medicaid eligible or not? They are, yes, okay, thought so. So if we combine those two and put them under the same 10% umbrella, is there a way to calculate that? That's a question for now,
Yeah.
but the answer can come later, but I'm just wondering if that's a possibility.
Do you know what their hourly rate is right now? Do you know?
Yeah, I mean,
Sarah, do you know if there's anything in the budget that increases this hourly rate, or is it built in?
This is a new request to me, so I'm just seeing it now, but adult days are included in the rate increase, so I'm not sure
So this
how
would,
this is different from that, what they want to carve out for something different. And
well, the
so-
question would be, what's the benefit to them, how close does it get to what they're asking for?
Mhm.
And then you also have to consider the other entities that are asking at the same time, so we want to put that out.
Do these adult
Yes.
days include?
Kids.
ones that are closed?
sorry.
Pardon me?
Do these, how many adult days are we talking about? Because some of them have closed, are they expecting to try to open?
Yeah, this might open them up.
No idea.
Yeah, I think it would just be the ones that are still
Ones that are
open,
still
but certainly
running.
if one was to open somewhere.
Okay.
Financially viable, one might go.
So that, if they were already included in that little 10% category,
Yeah.
then it almost makes the other one null and void unless it's gonna keep them, unless the 10% keeps them at $5 an hour or 10, a minimum wage. So I'm just trying to figure out, so that,
I'll give reach out to Dale and find
yeah,
out,
okay.
where that, what this gets us to. Resource Center for Justice and Well Vermonters, they're asking for, there's a one-time $1,000 request to establish a resource center.
I think this is the one that I was thinking about earlier for reentry recovery. And how does that fit, if at all, with the Women's Correctional Center pilot program? Maybe there's a way to put those two together, I don't know. But I know that the person who I had communicated with about this one was Tom Dalton, who has years of experience with reentry programs. So might be worth just thinking about a little
Well, I
bit.
think this one's specific to substance use disorders.
Is it? Yeah, so it's the MAT trying to get people back without, falling back on the correction.
The next one is, there was there was initial proposal from last year. And then I guess upon request from Senator Lyons, or somebody, was to modify it. So I put them both in here.
Yeah.
Or maybe it was Senator Hardy, I can't remember. But the original request was a request for 1.59 million with one-time ARPA funds over 3 years to build on the Family Center of Washington County's model to expand the Salesforce Community Data System solution across all 12 regional children's integrated service fiscal agents and their subcontractors. Well, this is an ask for one-time ARPA funds to fund this expansion. I put this in there, they didn't. That there could be some ongoing costs. So I looked at the sheet they had was very laid out very clearly and very nicely. But I feel like I had to flag that, you know, this would be, there's, even though it's upfront, a lot of it's established, there would be ongoing
Yeah,
costs in the out years. And then the second part where they modify it for one-time funds over 2 years to just 4 regions. And so that brings that 1.5 down to 312, 900,000. But it could have some ongoing costs, about 130,000. So I always have to flag things.
You know, and I guess the question is, and I know Ruth has been working on this, Senator Hardy's been working on this, that if we chose to support the second, less costly, are those the areas where the need is greatest for integrating for
No,
Canadian
so-
services?
What the reason, the modified sort of scaled down request, those are the 4 regions that are the most ready to implement it, that have done some groundwork on it, so they could get it going faster. All the regions want it and are you know, need it. And the irony, as I was talking to Matt Levin about this, is that the counties that are listed are none of our counties. So I was like, we need to have the full one in there. I mean,
I think
Washington.
Addison and
County's
Chittenden and Rutland and Washington should be in there, right?
Well, Washington's already is the only one that has it. They have it
I
right
know,
now.
they're good.
But the 4 counties that would be the next in line with the smaller requests that are sort of ready for it now
Yeah.
don't include the other 3 counties. So I was like, oh, we need to have at least both of them on.
Well, I'm
there.
also thinking about population levels and need, so, okay.
Yeah, so they all need it. It's just a matter of who's the most ready right now
Yeah.
to implement it faster. So if we can only do scaled down, the scaled down, they're sort of.
Okay, and I think that, you know, maybe have a conversation with Matt Levin and maybe we can look at this, because I have been a strong advocate for improving the whole GIS process, and this will help.
And I think the one,
No, not now, please.
the one-time, the ongoing funding, I think I would have a question about that, about what that is, but,
That was based on just, in their sheet, they showed like some ongoing staffing and administrative costs to do it that would clearly have to have, from my interpretation, I would have to continue on. Like, so most of the cost is like getting it up, getting it ready, buying the stuff, but there's some admin costs and some licensing things that I believe, I don't know what are from that are ongoing. And you know, they can correct me if they think that my number's higher.
Yeah, we'll sort that out, and
Yeah, we can
it'll
sort
have to
that
be outside of committee time, because we wanna keep moving along.
Yeah.
And if we have a minute at the end, we'll reach out to a friend.
Okay.
Okay,
And I will open up, you know, anyone who's listening, if they disagree with some of my interpretations, I'm happy to correct it.
we're going out.
So next one is for comprehensive care clinic for HIV/AIDS at University of Vermont Medical Health, UVM Health Network. And this is a request from Dr. Singh and Zipporah Perry. I wrote for UMMC, it's actually UVM, hence.
She was my general practitioner.
So this would be to increase the need for mental health substance use disorder services for this population, for offering more outreach services to patients who are unable or unwilling to present medical facilities. So it's 60,000 to hire a mobile outreach and 50,000 to hire a 0.5 FTE social worker.
I'm trying to sort out where this is coming from, so I'm just sort of, this doesn't, this hasn't bubbled up for me, this one is trickled down. too well, so. Anyway, that's me. Okay,
The next,
and it's
sorry.
currently in my district, so.
The next four were tied to suicide prevention.
Yes,
These were
yeah.
all part of the, I believe they were all part of what you discussed yesterday for the S69.
Yes,
So we have 1.2 for zero suicide program expansion. Which according to them, I think there's 260 in the budget already. Was not able to confirm that. And maybe it's on Sarah's list.
Sarah's got, we've
Already a
got
bunch in the budget.
language, you've got the suicide coordinator position is in there.
All right, well, literally threw this in 5 minutes before I walked in the room, so I was unable to.
That's okay,
To
We get it.
distill. So there's 125 for the prevention director. Yeah, 1.3 for the 988 line. Oh, I gotta go back to the 988 across line. So I think there's a little confusion because people saw there's $440,000 in the general fund. I think there was some sense that that was the amount, but actually that gets matched. So it's $1 million, if I'm correct.
how does it get matched?
Because I noticed it was under global commitment. So I noticed
Okay,
that, oh, sorry.
No, it's just 440,000.
Oh, then why did I saw it somewhere that it was grossed up. That it was 440, it was grossed up to $1 million. I saw it somewhere in the ups and downs, so I thought that maybe okay. All right, so I will correct that.
okay,
So the only person confused in this one apparently was me.
no. You're not the only one who's confused.
So let me fix that. So Aaron, I'm gonna send you an update of this sheet. Some point.
The position is already in, the 125 for the position is already in the
Yeah,
budget, right?
it's already in
And then
there.
what else is there's already some of the other stuff in the budget too, right?
Yeah, there's $260,000 for the zero suicide is in the budget.
Yeah.
And then there's 440,000 for the 988.
So are the numbers you have here, the 1.35 and the 1.2, are those net?
No, the 1.35 is wrong because I thought it was matched. So I have to fix all the math with it.
Okay.
They were asking, I don't have the letter in front of me now.
You know what?
Oh, you know what? I think that was their request to increase it to 1.35 million. No, that is their ask.
Yeah.
It was the language around the 3 million gross that's wrong.
Yes,
So yes, they're asking for us to increase to 1.35 million from 440. General.
but not the 3,
3 million was thinking it was gross, but it's not. So 1.35 is the ask. Sorry about that.
sorry.
And then the last one is they're asking for 100 for elder care clinician program and the vet-to-vet visitor program. They're asking for 100,000 to expand either or both. And then the very last is the diaper bank, $180,000 to ensure the diapers are statewide distribution until the middle of next year.
So
So,
last year we put in, or whatever, $50,000 that went into the food bank for diaper distribution. Now it's up to 180,000. And there is need out there, we do know that. Okay,
apologize for all the,
well, no,
Typos.
that's why we go through it the
Yeah.
first time like this and identify where we have questions and where we can get, and if you can update that when you, in all your free time.
Sure.
And then, he's kind of heard our questions, and I was thinking it might be helpful for us to bring in, I think Monica Hutt is the person to come in from the chief prevention officer and talk a little bit about the prevention council and what their capacity is, because there's a lot here about prevention and then how any of those prevention funds would be distributed if and when they were appropriated. And that covers a whole lot of ground in terms of opioid and substance use disorder generally, as well maybe as some of the MAT considerations, because it is a cross-agency I see, do you think that's a good idea, Sarah? Okay, we'll do that. I'm thinking if we have time on Tuesday even, we could have Monica Hutt in if she's available. If she's not, we'll find another time. All right. Questions for Nolan and Sarah? I just want to.
Both the milk and the diapers were general fund funded last year.
They were general.
Oh, they were?
Yep, they were.
How much?
82,000 for diapers and 25,000 for milk,
So it's 75.
separate appropriations. And the diapers flowed through the food bank.
Okay.
So you're gonna update this and resend it, so.
Can't hear you, Senator.
I'm talking to Nolan, sorry. Also the suicide, there's part of it, they're asking for, to increase money to DAs, which is already, I mean, if we're able to get the 10% for the DAs, then it seems like there's an overlap there as well.
I think that's a good question, what is included in the home and community-based service section? So who's eligible for the 10%? And then that would include the question about the adult days and what they might do to that. I think that's
I'll send Aaron, I have a list from AHS of, it's not an exhaustive list, but of the providers that will get that 7% rate increase that's in the House budget.
Okay.
It's in that list.
okay. This is good. I think our goal here as a committee is, as I was thinking earlier, and then I'm going to reach out to a friend in a minute, Matt Logan, in a minute, so I'll go away, is to look at ways that we maybe can combine some of these requests where they fit. And I include within that, well, as we go through H703 and workforce discussions, we may want to try to sort out how to do that efficiently, so that we can make a recommendation down the hall. But that might be a little more cumbersome just because it's in another committee and we have our work here and folks will have it. So we'll hold that thought, but please look at the workforce piece as well. But then think about the bills that we have passed, and we do have priorities for those. We've talked about our parent-child centers are critically important for funding. And the other bills that we have passed that no one has listed. What, if anything, can we recommend? I think we've already recommended by passing the bills out. And we have others that we are passing out. So think through those bills and then think through, we said workforce, that one is, put that one on the back page, but I want to think through that, bless you. And then prevention, get Monica in and we'll try and talk a little bit about opioid substance use. And then the whole arena of childcare and what fits there, and I'm including that CIS. Okay. Go ahead.
Oh, well, I was just gonna say I was just looking at our bill, sorry. The 120 that's in the child advocate bill, I don't think that's in the budget, right? So that would be an increase.
Yeah, we probably
And-
should put that one in.
Because some of the things that are in the bills are in the budget,
Yeah.
and some that aren't. But, and then I don't see it on our list, or maybe, oh, no, here it is. The housing and care for adults with developmental disabilities.
720.
Yeah, 720. So, I mean, there's some money in that, and I'm frankly interested in increasing.
It's on our list.
Yeah, I know,
Yeah.
I'm interested in putting more money into that bill, so.
Is it 600 and,
602,000.
so that's funded with the HCBS enhanced FMAP bump. So if there's not a specific appropriation in the big bill, but there is the structure that AHS is using to deploy those dollars. So just as you contemplate changes, we talk about that structure. That'll be in the language I send over. I'll try to highlight like this is where the HCBS appropriations are
Great.
happening.
Yeah, and if we're talking about FMAP, we have to be very careful. Very careful about it.
Right, well, there's also potential for housing money for that bill. And I've been talking to our friends in economic development because I think that is a housing expense and trying to figure out if we can.
Yes, well, the
flag or do
housing
something.
issue, you're right.
There's so much money in housing and this is a housing issue and it just seems to me that,
Right,
We should
and
be
the
able
rest
to-
events or housing issues, you know,
Yeah.
you're right.
so I think there's some flexibility, but highlighting that would be helpful, Sarah.
Yeah, I can do that.
Yeah.
Okay, I know that Nolan and Sarah were only here until 10 o'clock. and I
No, I'm here
appreciate-
until noon, because I'm here
Oh,
from 4 to
good. Thank you,
6.
Sarah. Thank you so much. One last question, and then we're gonna take a break. And Matt, can you clarify for us the
Yes.
CIS piece?
Oh, sure, I'm sorry.
Here.
Madam Chair, so Matt Levitt for the Vermont Early Childhood Advocacy Alliance. Just one tiny correction for the reduced proposal for CASIT. There will be an ongoing cost. The providers would absorb those ongoing costs. Nolan's very perceptive. For the larger proposal, there would be an ongoing cost for the state on the out years, but for the reduced proposal, the providers would absorb those ongoing costs once the initial startup happens. So there's just a tiny correction. Just note there would not be that $120,000 that you indicated on the chart, that would not be an ongoing cost to the state.
Okay, so what happens then when the rest of the counties or areas move into CIS? Are they gonna have, or will there be, why is there a differential?
Yes, the difference is because the larger proposal contemplates the entire system going, and that would require some work on behalf of CDD to support the system.
Yeah.
And so once you get everyone in, then there is some cost to the state. This interim proposal, this stepwise proposal is a little bit more segregated within the providers, and so therefore that additional cost doesn't come into play. It would come into play when everyone comes on board. I'm not trying to hide anything, but that stepwise proposal doesn't have that yet. That's all, just one tiny correction.
Good, thank
I will
you.
make that correction on my sheet. Thank you.
Okay, so the other issue is, no, I sent Nolan and Katie, ooh, I got a ladybug.
That's good luck.
That's good luck. Some language from Joellen Torillo of the Suicide Prevention Group that might satisfy our interest. It's different from the trust fund and the restricted fund language. So we'll try and look at that too as we're moving forward, because I know suicide prevention is pretty critical. So what I'm going to suggest now is that we go off YouTube, Aaron,